Welcome to our video on substance use and teratogenic medications in pregnancy. Let's get started. Here's our overview slide. Let's start with substance use in pregnancy. With regards to this topic, we'll be discussing alcohol, tobacco, cocaine, and opiate use during pregnancy. We'll begin with alcohol use. It's important to note that there is no safe amount of alcohol to consume during pregnancy. However, the most detrimental effects are typically seen in patients who drink at least 2 to 5 drinks daily. Consumption of large amounts of alcohol during pregnancy can lead to fetal alcohol syndrome. This syndrome is associated with growth retardation and central nervous system effects, such as intellectual disability. There are also some characteristic abnormal facies that can be found as well. Any mother who is consuming excessive amounts of alcohol during pregnancy should receive aggressive counseling. They should also be monitored for nutritional deficiencies that are more common in patients who consume large amounts of alcohol, such as thiamine, folate, and vitamin B12 deficiencies. Here's an illustration demonstrating some of the characteristic facial findings of fetal alcohol syndrome. Patients can have skin folds at the corner of the eye and small eye openings. They may also have a short nose and a low nasal bridge. Patients can also have an indistinct philtrum, which means that the groove that is present between the nose and the upper lip is smooth. Their upper chin can also be thin. Other characteristics include a small midface, which is sometimes referred to as midface hypoplasia, as well as a small head circumference. Another commonly used substance during pregnancy is tobacco, typically in the form of cigarette smoking. The effects of smoking on pregnancy are increased with an increased amount of smoking. In patients who smoke, there is an increased risk for spontaneous abortions, preterm birth, and placental abruption. In addition, infants who are exposed to tobacco in utero and after birth are at an increased risk for sudden infant death syndrome. Any patient who is currently smoking during pregnancy should be encouraged to at least decrease the amount of smoking if they're unable to quit. Patients who use cocaine are at an increased risk of intrauterine growth restriction, preterm labor, and placental abruption. These risks are due to the vasoconstrictive effects of cocaine. If a pregnant mother is using cocaine, social services should be involved in the patient's care and the mother should be encouraged to detox if possible. Okay, now let's discuss opiates. The most commonly used opiates during pregnancy include oxycodone, heroin, and methadone. The opiates themselves are not directly teratogenic. However, withdrawal from opiates while pregnant can lead to miscarriage, preterm delivery, and fetal death. Mothers using opiates while pregnant should be encouraged to start a methadone program rather than quit due to the potential complications of withdrawal. Any infant born to a mother who used opiates during pregnancy should be monitored closely and will most likely require weaning off of opiates at birth. All right, let's try a question. A 15-year-old boy is brought to the physician by his parents for a checkup. He was born at 38 weeks of gestation via vaginal delivery. The patient is exclusively breastfed and he has already regained his birth weight. His mother smokes 1 pack of cigarettes per day. His vital signs and physical exam are unremarkable. What is this neonate at risk for due to his exposure to cigarette smoke? All right, this neonate was born at term via a vaginal delivery. He is exclusively breastfed and has regained his birth weight. Although the patient's overall condition is satisfactory, his exposure to cigarette smoke can predispose him to sudden infant death syndrome, or SIDS. SIDS is an unexpected death of the baby before 1 year of age. Okay, now let's move on to discuss teratogenic medications. The medications we'll be discussing include warfarin, ACE inhibitors, isotretinoin, lithium, and anti-epileptics. Let's begin with warfarin. Warfarin is a medication that can easily cross the placenta and have teratogenic effects on a fetus. If exposed during weeks 6 to 9 of pregnancy, warfarin can cause nasal and midface hypoplasia. If exposed later during pregnancy, warfarin can lead to hydrocephalus. Now let's discuss ACE inhibitors. ACE inhibitors can also have teratogenic effects on a fetus. These are associated with limb contractures and growth restriction. Okay, now let's discuss isotretinoin. This is associated with fetal loss, craniofacial defects, thymic defects, cardiac defects, and CNS defects. Lithium use during pregnancy is associated with a cardiac anomaly known as Ebstein's anomaly. Here's an image of a specimen and echocardiogram of Ebstein's anomaly. Ebstein's anomaly occurs when lithium exposure in utero causes downward displacement of the leaflets of the tricuspid valve, leading to a portion of the right ventricle that is quote-unquote atrialized. This means that this portion of the right ventricle functions as the right atrium. Eventually, it can become extremely dilated and take up more and more space of the functioning portion of the right ventricle. Take a look at the specimen image on the left. This portion represents the atrialized right ventricle, while this portion represents the part that functions as the right ventricle. The same anatomy can be visualized on the echocardiogram. Here is the atrialized right ventricle, and here is the functional right ventricle. Okay, moving on to anti-epileptics. These are commonly recognized for their teratogenic effects. Both carbamazepine and valproic acid are associated with neural tube defects. Phenytoin is a folate antagonist, and the use of this during pregnancy can lead to abnormal facies, cleft lip or palate, microcephaly, growth deficiencies, and neural tube defects. Here is an image showing the neural tube defect spina bifida. Remember that the medications associated with neural tube defects are carbamazepine and valproic acid. Spina bifida is a neural tube defect that affects the caudal end of the neural tube. There are several different forms of spina bifida, but the one represented in this image is myelomeningocele. The image shows that this neural tube defect results in the dura mater, spinal cord, and spinal fluid all located on the outside of the spinal cord. This image shows a child with a cleft lip. Remember that this is a potential teratogenic effect of phenytoin. In this image, one can see a unilateral cleft lip, which occurs when the facial prominences do not fuse during embryologic development of the face. Here is a table to help you review the effects of substance use and medications during pregnancy. All right, let's wrap up with a final question. A 6-year-old boy is brought to the physician due to problems at school. Teachers report that he never listens and he constantly walks around the classroom. The patient blurts out the answers to all the questions without considering his classmates. He was born at 39 weeks of gestation to a 28-year-old mother via vaginal delivery. His vital signs include a temperature of 37 degrees Celsius, a blood pressure of 100 over 80 millimeters of mercury, a heart rate of 92 beats per minute, and a respiratory rate of 15 breaths per minute. The physical exam shows a smooth philtrum, a thin upper lip, a short nasal bridge, and small palpebral fissures. In utero exposure to which of the following substances is the most likely cause of this patient's current condition? A. Alcohol, B. Cocaine, C. Tobacco, or D. Heroin. All right, this patient presents with the symptoms of attention deficit hyperactivity disorder, or ADHD. Specifically, he never listens, constantly walks around the classroom, and blurts out the answers to all of the questions. The physical exam shows a smooth philtrum, a thin upper lip, a short nasal bridge, and small palpebral fissures. This is a classic description of fetal alcohol syndrome. Therefore, in utero exposure to alcohol is the most likely cause of this patient's current condition. So the correct answer is option A, alcohol. This is the slide reminding us of the effects of alcohol on pregnancy and the fetus. Let's discuss why the other options are incorrect. Option B, cocaine, and option C, tobacco, are incorrect because in utero exposure to either of them is most likely associated with preterm birth, intrauterine growth restriction, or spontaneous abortion. Finally, option D, heroin, is incorrect because maternal heroin abuse during pregnancy is associated with neonatal abstinence syndrome. This is characterized by neonatal irritability, diarrhea, sneezing, tachypnea, tremors, and possibly seizures. So again, the correct answer is option A, alcohol. And that concludes this section.